So how is it that the criteria for pathological gambling came about?
Well, the first criteria for pathological gambling were in DSM-IV, which was introduced in 1980. And Bob Custer is credited with creating the criteria, and they came out of his clinical experience. He had a treatment program for gamblers starting in '72, and was very active in starting the National Council on Problem Gambling. And but actually, the way the criteria came in was not through his lobbying, but Bob Spitzer, who was head of the DSM-III, had compulsive gambling along with kleptomania and pyromania as impulse disorders, and probably based on an old classification that goes back to the monomanias from the 1820s or early part of the 19th century. And then Bob Custer got involved and wrote the criteria, and the name was changed to pathological gambling because compulsive gambling was a misnomer. You know, it's not a compulsive behavior. It was more something that people, at least initially, wanted to do, and not something that they felt externally driven to do. You know.
So let's talk about the criteria and kind of go through them individually. One of the criteria talks about preoccupation with gambling, where an individual is thinking about past gambling experiences or planning their next venture with gambling. Can you talk a little bit about that particular symptom of the criteria?
Well, the way I think of it is past, present, future. And the past is that they relive the gambling experiences, either winning experiences or losing experiences. The losses they can't let go of, the wins. Frequently you'll be seeing a pathological gambler and they'll tell you the first time they gambled or their first experience at the track, and they will remember exactly how much money they made, what the odds were, the exact conditions, and in telling you about it, they not only have this incredible detailed recall, but they will re-experience it while they're talking about it and get into the action or the excitement. The preoccupation includes they're thinking about what they're going to do next time they go gambling. Handicapping, whether it's sports or horse racing, may be an important part of it. Or they may be thinking about how they're going to get money to gamble. So between the gambling episodes, there's this preoccupation with the gambling.
In your clinical experience working with hundreds and hundreds of patients over the years, do you find that that preoccupation is a constant kind of a nudging them and on their mind, or is it more episodic where they have maybe a day or two where they're thinking about it and then a day or two goes by and they're not thinking about it? What's been your clinical experience?
Well, it can vary. You know, when you generalize about a disorder that's really heterogeneous, you know, you have to be careful. There are some pathological gamblers who are binge gamblers, for example, who don't gamble every day, but may gamble just 3 or 4 or 5 times a year. And between the episodes, they may not be thinking about gambling at all and living their lives, and then something will trigger them to go gamble. But there are other pathological gamblers who, during those periods between the gambling episodes, are thinking about gambling, and it's only a matter of time until they're going to gamble. And they may be, in fact, planning how they're going to get the money to gamble and waiting until they have enough money, you know, and so it's something that's a preoccupation of theirs.
Another one of the symptoms of pathological gambling is a need for this increased amount of money that they will spend in order to achieve the same excitement as a result of the gambling. Talk about that criteria.
Yeah, that's tolerance, and this is one criteria which, if I were revising them or rewriting the criteria, I would expand on that a little bit, because it's not just the increasing amount of money that they gamble to get the certain level of excitement, but it may be a need to take greater risks, or for example, what you see when you look at someone playing a slot machine, and you'll see someone playing 3 or 4 machines at the same time. So it's this increase in the activity over a period of time, and that's a kind of tolerance. And
somehow the status quo just isn't enough anymore. They need more of something as it pertains to gambling in order to achieve the same level of experience.
Right. And also, I think related to it also is a kind of generalizing of the gambling. That someone who starts out, for example, as a sports bettor, will gamble on high school games, or teams that he knows nothing about, or a horse player will go to and gamble at the state fair, and just this need to be in action, or to generalize their gambling into areas that they know nothing about, just to keep gambling.
This next criteria is often considered kind of a hallmark of addictive disorders, and that is this multiple unsuccessful attempts to cut back or control or stop the gambling behavior. And that's something that pathological gamblers can experience. Talk about that.
Yeah, interestingly, this is the one that I think gamblers are most apt to say no to, in that they'll say, well, I never tried to cut back, or I never tried to stop. And so therefore, it's scored as a no, but in actuality, it's a more severe problem. Some gamblers are not aware of what they go through in trying to cut back. So
it seems that if they're experiencing a lot of undesirable consequences, but they persist in the gambling, that's some evidence that they're not able to regulate their gambling behavior. Would that fall under this criteria?
Yeah, the loss of control. Yeah, definitely.
So another criteria that's been advanced in the DSM-IV is this notion of restlessness or irritability when attempting to cut down or stop the gambling behavior. Is that something you've noticed in your own patients?
Well, this is the withdrawal item, and not only that I noticed it, but I did a study of withdrawal symptoms in pathological gamblers, and Henry Lesieur and I found that was extremely common for gamblers, not only to have psychological, but to have physiological symptoms when they were cutting back or stopping their gambling.
When gamblers are restless or irritable, what does that look like? If I'm the spouse of a gambler or a family member of a gambler who's starting to have problems, and I see them being restless or irritable, I mean, what does that look like?
Yeah, I think it would be very noticeable, and along with that restlessness in the house and making excuses to leave, and agitation, anger, blaming, provoking a fight, anything to get out or to be able to leave. Yeah.
It seems that restlessness would need to accompany this desire to gamble, but not maybe being able to gamble, as opposed to, we see irritability, for example, as a symptom of bipolar disorder when people experience mania or hypomania. How would you differentiate this irritability that's associated with gambling as opposed to irritability that patients with bipolar experience? Can you comment on that?
Well, the pathological gamblers, the gambling and what they look like can mimic a number of disorders, but very typically mania, and the grandiosity, the overgenerosity, going without sleep, but the agitation, the drivenness, the irritability, certainly. And with the gamblers, though, it would be specific for their wanting to gamble and the urges, the cravings, the need to gamble, whereas in bipolar disorder it might be either non-specific or they may not know what it is that they need.
Another symptom of pathological gambling is this tendency to gamble as a way of escaping or as a way of dealing or relieving dysphoric mood states such as depression or anxiety. Talk about that. Yeah.
This is, I think, the central problem for the pathological gamblers. I think it's present 100% of the time that the gambling is a way to avoid or escape from either some problem that they think is unsolvable or some intolerable affect. Yeah. And and the examples that are there are the shame, guilt, helplessness, very commonly, depression, and that gambling is a way to numb their feelings, to distract themselves from it, but also as an avoidance or escape. And it works in that the gambling then creates new problems, and so it does distract.
It's almost like a downward spiral for these individuals. They gamble, and then they might experience some guilt as a result of their gambling, and then they turn back to gambling to cope with that guilt.
Exactly.
Some people differentiate guilt and shame. While you've mentioned shame, guilt is a sense that my behavior is bad. Shame is more a personal critique of
that I'm
self is bad. Yeah. Can you comment on that, the shame that you've noticed in patients over the years?
Yeah, I think it is extremely important, and it's that I'm bad, and that the unacceptableness, and it leads to isolation, to feeling excluded from the group, and the shame is at letting down one's expectations or values for oneself, and is clearly different from the guilt that they experience.
This notion that gambling could be used as a way to deal with anxiety almost suggests something that some advocates have talked about in terms of a tension reduction model where gambling somehow relieves the anxiety. How does gambling do that? Or even relieve any dysphoric mood state? Is it just kind of a distraction from that mood state?
Well, interesting that you mentioned tension reduction, which really was one of the central features in DSM-IV, and is or was central for all the other impulse control disorders. That and was even in the diagnostic criteria, that there was increasing tension and then relief with the commission of the act, and then there might be shame or guilt afterwards. But the impulse disorders were conceptualized according to a tension reduction model, which basically was a psychoanalytic model. Pathological gambling was the only one of the impulse control disorders that was conceptualized differently, and Bob Custer emphasized the preoccupation rather than the tension reduction. But certainly, in terms of the question you asked, with the impulsive behaviors, there is the belief that doing something, acting out, is a way to relieve whatever anxiety or dysphoria one is experiencing, and that one can escape, one can get away from whatever it is that is bothering you. And I think that's central to these disorders. Yeah.
A lot of people maybe go to Las Vegas for the weekend, or they may exercise as a way of escaping, or play video games and so forth. What differentiates the pathological gambler who's using gambling to cope with stress, for example, or escape in some way, and the average person that may in fact use gambling to escape at times as well? Like, what differentiates those those two individuals, the one who's pathological and the one who's not?
Yeah, this is, I think, central to the question of the difference between problem gambling and pathological gambling, and problem gambling being a subclinical state. But the way that I would describe it is that anyone can gamble compulsively. Not anyone could become a compulsive gambler. In other words, a person goes to Las Vegas, bets more or loses more than they had planned, feels terrible about it, may even chase for a short while, but they stop. It's a certain kind of person, and I think a certain kind of personality that's going to continue and not learn from the experience and keep going, keep losing, and get deeper and deeper.
Another one of the criteria for pathological gambling is this tendency when they lose money gambling to return another day, to often return another day, to try to make up for that loss, chasing, as it's been suggested. Can you talk about that?
Yeah, this is what we were just referring to. The chasing is something that a lot of people will do, and the trying to get back what one has lost, and the key in that criteria is the two words. One is often and another day, and that while anyone might chase in the short term, that the pathological gambler not only does it frequently, and characteristically, but engages in long-term chasing, so that it's not just during that session, but they're going to try to get back what they lost for the week or for the season, and they engage in what we call malignant chasing. Yeah.
So is this kind of reflecting, and I don't know necessarily mean it means an either or, but it seems like some people could chase their losses because they just have this competitive personality characteristic, versus individuals who may chase almost out of a desperation, like I have to somehow, now I'm really in the hole, I've got to somehow get that back. What do we see in pathological gamblers?
Well, it is desperation, and some people, as you mentioned, chase because they're competitive and they just can't accept that they lost. The sense of entitlement that a lot of people have, that narcissistic entitlement, they can't believe that they lost, and that the casino has their money, and that they have to get it back. The other motive for chasing is the guilt that people feel, and there's this, and these are irrational ideas, that if you win back what you had lost, it's as if you had never gambled. And not only that you're even, but it's as if you'd never gambled in the first place. So kind of the idea that two wrongs make a right, and that you can undo or erase the experience of having gambled and lost. The chasing is irrational. And some people have said, no, it's a rational way of trying to get one's money back, but it is irrational, and I think it is psychologically driven by the desperation that you mentioned. And the thing about the chasing is that it's not just trying to get one's money back, but one gambles differently, and out of the desperation, one takes greater risks, one tries to get it back all at once, and completely abandon whatever gambling strategy or discipline that one had prior to that.
Another one of the criteria is lying to family members, a therapist, or others to conceal the extent of their involvement in gambling. What does that look like?
This is the secrecy on the part of the gambler. It's related to the progressive shame and guilt that they feel, and the gambler may have started out as gambling socially, gambling with other people, and has become more of an isolated or loner type gambler, and so there's a lot of secrecy, as there is with other addictions, and certainly lying to family members, and the belief that as part of the shame experience, that if family members knew what they did, that they would be kicked out and would be ostracized.
It almost seems like in many of these process addictions, if that's what we want to refer to them as, that secrecy is almost the lifeblood of these particular patterns of behaviors. It's what allows them to be perpetuated over time, that they're able to conceal the extent of the involvement, as you say, because if people knew, they would be disappointed or outraged and so forth.
Exactly.
Another one of the criteria is this notion of committing illegal acts such as fraud or forgery, theft, embezzlement, to engage in gambling behaviors. Is that a frequent thing that we will see with pathological gamblers?
It's not as frequent as the other criteria. And in fact, there's talk now, and I think it's more than talk. I think that they're thinking of eliminating it from the DSM-IV pathological gambling criteria. And I think that would be a mistake, but I can understand that as more gamblers have gotten involved in treatment, and partly due to the education and the greater accessibility of treatment programs, that particularly in Canada, where treatment is provided and people are used to coming in earlier, that you don't see the severity that we had seen when we created the DSM-IV criteria. But when we first wrote that criterion, 2/3 of the pathological gamblers would turn to some kind of illegal behavior, and we felt that was important to have in the criteria. Strictly speaking, you don't need it to make the diagnosis, but I think it's still an important thing to be aware of.
Another criteria is that someone jeopardizes or has lost a significant relationship, a job or education or career opportunity because of gambling activities. Can you comment on that?
Yeah, and the fact that they continue to gamble while disregarding these kinds of consequences. So this is an item that I think defines the disorder. But some pathological gamblers will answer no to this, and then you'll say, well, wait a minute, didn't both of your wives divorce you because of your gambling? And they'll say, oh yeah, and so they don't always make the connection. But this is something that one regularly sees in the gamblers, that it affects their careers, their job, their family, their marriage. And
it's interesting that the criteria says that they could have lost or a job, for example, or lost a career opportunity or a significant relationship. But there's also some allowance in that criteria that they haven't yet lost it, but their gambling behavior is jeopardizing that career opportunity or significant relationship and so forth. And so it's not, they don't necessarily have had to have lost the opportunity per se or lost a relationship, but if the behavior is putting that relationship at risk of being...
Well, or seriously jeopardize it, yeah.
One of the other criteria is this idea of relying on others to provide money or relief a desperate financial situation caused by gambling. What does that mean?
Yeah, that's the bailout, and one often sees that there are a series of bailouts, and there's this pattern of going to family for loans or for money to pay gambling debts, and that each time that they do, they feel they get away with something and their gambling gets worse.
So what this particular symptom suggests is that family members, perhaps employers, coworkers, others, relatives perhaps, that by giving the gambler money, they in essence may be enabling the gambling behavior and perpetuating the problem. And if we see that pattern that the gambler has to go to these people in order to maintain their gambling behavior, that in fact could be considered part of the tendencies for pathological gambling.
Mm-hmm. Yeah, exactly.
So all of the symptoms that we've been talking about, they have to persist for a particular period of time and cause this significant distress to the individual. Is that something that's required?
Well, actually, these are, and this is something that has been talked about quite a bit. These are lifetime criteria, and they vary, but they basically need to be present. The criteria don't put time limits on it, and some of the disorders must have this for 2 weeks or longer or whatever, and not always with evidence to support that, and it makes it more scientific. But no, these are not symptoms that or criteria that need to be present for a certain period of time. Yeah.
But as long as
it's more of crossing the line and whether these continue to progress or whether they were there at one time, and they do tend to cluster and to be present. If someone is gambling and out of control, that they will have a number of these at the same time.
At the time that a clinician is diagnosing or assessing a particular patient, they will have had to have met 5 of these criteria. And do those 5 criteria have to be currently present in the individual's life, or are you suggesting that it's possible that those criteria could have been present at some point but not currently, and that would count for someone to be diagnosed with a current pathological gambling problem?
I would say so, yeah, that the person met those criteria, maybe is only gambling and out of control during the football season, and that you see them 6 months later, or that they had that problem but are not currently gambling at the time that you see them for whatever reason. They don't have money. Yeah.
And then finally, one of the potential confounds for a diagnosis of pathological gambling is this notion that the person has a bipolar disorder and is gambling in a way that they appear to meet these criteria, but that's only in the context of a manic or hypomanic episode of bipolar disorder. So is that suggesting that if someone only gambles exclusively in the context of a manic or hypomanic phase of bipolar, that they cannot be diagnosed with bipolar disorder? Is that what that's suggesting?
Well, this is, first of all, it's a partial exclusion criteria. So somebody could meet and have both disorders. Yeah. If their gambling only occurs during a manic episode, then you would say no. They have a gambling problem, but only during the manic phase, and the disorder is the bipolar disorder. But if you find that they have a gambling problem when they're not manic, or that the gambling isn't explained by the bipolar disorder, by the mania, then you diagnose both disorders. Interestingly, there was really no evidence for making this an exclusion criterion. And it was something that was imposed on the Impulse Disorders Committee by the hierarchy, whatever, of the DSM-IV task force, the APA, and was one of several things. And there was actually a lot of protest about it. People thought it would make the diagnosis more difficult, but it was one of several things that have been done since DSM-III to diagnose fewer pathological gamblers, and there was a concern or bias about there being the diagnosis being made and false positives, or the number of people that would be diagnosed. So that even, for example, when criteria for pathological gambling were identical to the criteria for substance dependence, the number of items one needed to meet were different for the two disorders.
As a final note, usually when clinicians are meeting patients who are seeking help for problem or pathological gambling, sometimes we have this magic cutoff of 5 of the criteria. Has it been your experience that in most cases that's not a difficult cutoff for these people to meet when they're coming in and asking for help with pathological gambling?
Well, actually, when we created the criteria, we had recommended, and the research that we did supported it being 4 or more. And again, that was an instance where the APA wanted it to be 5, and were more concerned about the false positives than they were about missing some pathological gamblers. But it actually works better if it's 4 or more. And but in answer to your question, I don't think it's a difficult diagnosis to make. I think with most pathological gamblers, it's a fairly easy diagnosis, and the criteria seem to be easy to use. Also, the number of criteria is a good measure of severity, and with those who meet 8, 9, or 10 of the criteria being the most severe, and those who meet 4, 5, or 6, much less so. And in fact, if one's thinking of controlled gambling or harm reduction as an option, it might work with those who meet 4, 5, or 6. It's not going to with those who meet 8, 9, or 10 of the criteria. So.